Let's talk about the different code cart medications. Every hospital's code cart is going to look slightly different, but the majority of them are going to have the same meds across the board. I found this picture just on the internet and I kind of did all this little text over so that way we can go through all the different medications that you might find in a code cart. Up top here we have your atropine. Your atropine is going to be for your symptomatic bradycardia patients. We also have calcium chloride. The heart loves calcium, and so if a patient is low on calcium, the heart can get very irritable. There's a couple other reasons that we'd give calcium chloride as well, but that's kind of the main one. You got your standard epi. These, you should have quite a few of these in your code cart. We've got D50 for your patients with their low blood sugars, lidocaine, and sodium bicarb. Now, I should mention that some of these medications are in your ACLS protocol, meaning we are able to give them to patients without a provider there or present because it's part of your ACLS orders. But a lot of these medications are not in the ACLS protocol, and these are just standard medications that are kept in the code cart to handle any sort of ACLS situation or another emergent situations. On the bottom, we've got your adenosine. This is going to be for your very, very fast heart rates that we're trying to slow down, like your SVT. We've got amio, Benadryl. This one's actually not in our code cart, but I think that's interesting that Benadryl's in this code cart. Some more dextrose. There's also some epi vials. A lot of times there's a lot of amps of epi that come in the boxes, but you'll also have like an epi vial that has, let's say, 10 milligrams in the vial, and you can just draw up individual little epi doses from this vial. There's some mag sulfate for your torsades patients. Also have Narcan and Romazicon if you're thinking that your patient may be an opioid or a benzo overdose. This cart also has levo vials and neosynephrine vials, so that way you can pre-make up your pressor drips. And there's also Solumedrol in here. This is, again, not part of your ACLS, but may be very beneficial in a situation where a patient emergently has a bunch of airway swelling or another type of allergic reaction. Meds that I don't see in this code cart that are pretty standard are dopamine and dobutamine. I'm assuming these medications are probably in a different drawer. It's good to be familiar with all of these medications and know where they are located in your hospital's code card, so that way if you need to quickly pull them, you're not having to search through all the drawers. You can just identify exactly where they are and quickly give them, so that way we can minimize any sort of delay. Let me know if you have any more questions.